Welcome to the Lyster Health Talks podcast, hosted by Lieutenant Colonel Garrett Holt, the commander of Lyster Army Health Clinic and the Health Services Director at Fort Novosel. Each month, listen in as the team focuses their discussion on relevant and relatable health content that empowers your health and the readiness of the force. In today's show, we sit down with the Lyster Deputy Commanders to discuss the PCS season. Join us now for PCSing Tips for a Healthy Move.
Well, greetings, Fort Novosel. Lieutenant Colonel Garrett Holt here, the commander of Lyster Army Health Clinic. Today's episode is centered on permanent change of station moves, or as we like to call it in the military, PCS. But really, for all of you, it's really about just moving to a different location. I think we can all subscribe or relate to that in some way. So I think you're really going to enjoy our guest today. If you're a leader on Fort Novosel over the past couple of years, it's a very good chance you're going to recognize many of our voices. Sadly for us and sadly for me, all three of these incredible leaders are going to be departing us this summer. But it's really going to be okay because they've really structured so much for us and done such a great job that we're going to continue to vault off into the next chapter next year in a very successful way. But before I get too far ahead of myself, we have a lot of content to talk about today. And I want to take just a moment to kind of go around the room first to introduce my three deputy commanders. I'm going to start over here to my left. Major Kuhlman, go ahead.
Yeah, hi, I'm Major Kuhlman. I'm the Deputy Commander of Administration.
Awesome. How long have you been with us, Major Kuhlman?
I've been here 3 years now.
Lieutenant Colonel Murray, how about you?
Hi, yes, Lieutenant Colonel Erica Murray. I've been here for about almost 2 years.
That's wonderful. Where are you heading to next? Remind me.
Well, I am going to be going across the hallway over to the Department of Aviation Medicine.
Major Bailey, how about you?
Hi, I'm Major Joanna Bailey. I'm the Deputy Commander for Nursing and Patient Services.
Excellent. How long have you been with us, Major Bailey?
About 2 years.
Awesome. And also a belated congratulations to you as well, as you were selected for promotion.
Thank you so much, sir.
Well, we're going to dive right in. We got a couple of topics to hit. But first, before we get into the PCS move content, we want to talk about Heritage Month. You know, June is the Army's birthday on June 14th. It's also the Army Heritage Month that gives us an opportunity as the Army and as a community, rather, to reflect on nearly 250 years of our legacy in the United States Army. So our guests here are all field-grade officers, as you could tell in the introduction. And I don't know about each of you, but sometimes it's almost shocking to see how long I've been in the Army. I don't know if y'all relate the same, and sometimes it seems that my lieutenant time was an eternity ago, but also at the same time yesterday. But I'm it's also interesting to think back on why I joined the military in the first place and maybe why I stayed in. So I'd like to hear, now that all of you are seasoned leaders in the United States Army, I'm going to go over here, start with Major Kuhlman, to tell me a little bit about why maybe you joined the military.
So I initially joined the military for the benefits. I mean, a lot of people get drawn in by what you can do there. But really what kept me in the military was just the camaraderie that you develop while you're in there and all the different people you get to meet. So you get to meet people from all different cultures throughout the military, and that's really what's wanted to keep me here and has kept me staying throughout my entire time.
Yeah, I think we can all relate to that in a lot. And I think, there's a lot of ways that the military will entice us to come in, all good things, and certainly financial is one, education is other things, but really the people for sure. Hey, I'm going to move over to Lieutenant Colonel Murray. Why did you join the military?
Interestingly enough, when I got my acceptance letter for medical school, I was reached out to by a wonderful individual from the Army Nurse Corps who was recruiting nurses and physicians and said, "Hey, have you ever thought about joining the Army?" And I said, well, really it would tie in with my career motives. At the time I was thinking about trauma surgery, thought that would be a perfect fit. And so off it was. And after I graduated medical school and residency, I was ready to serve. I was stationed in Germany. So I got to spend 3 wonderful years over there with my husband, Grady, and then ended up getting another assignment in Korea. And so spent 4 years there. And given it's Army Heritage Month, I am half Korean, so I got to actually be stationed in Daegu, where my family roots were originated from. And then from there, just meeting individuals in the Army, knowing that the Army is small, loving the people that I met and all the adventures. It was an instant sign for me that this was going to be my life.
What's fun to me, too, is what you started your career is an engagement from an Army Nurse Corps officer, yet you became Medical Corps. And not just because I'm standing next to to an Army Nurse Corps officer, and I should speak to this, but I think it's amazing to see the influence of all medical Army medicine and their influence on our lives to really engage with us, not just to recruit, but really to retain as well as bolster our commitment to the nation. So certainly last but not least, Major Bailey, how about you? What made you join the military?
For me, it was family. So my dad was he retired out of Fort Lee as a sergeant major after 26 years. My brother was in for about 10 years. I had a cousin Jimmy. He was a Navy fighter pilot. So for me, the military was just ingrained in me. So when I look back and think about my family and my heritage and what the Army means, I see them as my giants. I see them as the ones that I get to stand on their shoulders because they've paved the way for everything that I've been able to do in my career. And now as a dual military family, as an Army mom, I look at my two kids, Isabella and Mason, and I just hope that one day they'll be able to stand on my shoulders too.
Oh, that's great. Well, I would say that generationally, the legacy lives on for sure in the United States military, and I'm sure in many ways that our listeners can relate to the same. Our family members that kind of have loved and supported us, not just in their current career, but the ones that have kind of guided our way into what we have today. And I really liked what Major Kuhlman mentioned. I think it resonates with all of us that, there's a reason that you join, but there's also a reason that you stay. In a lot of ways, it's the people. Well, that's wonderful, and it was just a fun moment to just be able to pause and reflect on that a little bit. I'd like to dive into our next topic, which is moves, PCS again, or permanent change of station, but we have a lot of content we want to talk about, but we're going to try and distill it down. I want to talk about really the moves, but not just from a healthcare perspective, but as a spouse, as a family member, as a parent. And it can be stressful. A lot of our listeners, I believe, are, this will be maybe their first move, and they might be moving just with their spouse alone, or they might have a full family. They're moving off from flight school after their first assignment or what have you. And then my gut is they're probably pretty stressed, as anyone would be. I know I've PCS'd more than a half dozen times, maybe getting closer to 10 times. And each one of them brings their own anxieties. But, I think there's tools that you can use that we can really dig into. So first, I want to pass it over to Major Kuhlman. I should want to also mention that he's my first line of defense, or my deputy commander for administration, meaning that he has oversight over anything managed care, TRICARE related at the facility. And I think he's going to dive in a little bit on that topic for us. So Major Kuhlman, why don't you tell us a little bit about something that our listeners should consider if they're moving this summer?
You may need healthcare while you're traveling or where you're moving place to place. So just keep in mind that you always have a reference in the nurse advice line. It's 1-800 TRICARE, which is 874-2273, and it's just option 1. So if you need healthcare while you're traveling, you can always call that line. They can give you good references about if you should go to an urgent care, if you should go to an ER, or if there's a medical treatment facility that's close by, they can help book an appointment for you so that you're not having to worry about where to get healthcare.
Yeah, that's great. What's interesting too, let's see, I think, like I said, Lieutenant Colonel Murray's not traveling too far, so she may not have to be too considerate about that. But Major Bailey, you're moving up to the Pacific Northwest, right? So that might apply to you. I
am, and I'm doing a couple of stops along the way. I know I'm going to go visit some family in Tampa for a little bit, but then we're going to San Antonio and then South Dakota. So that's great information about the nurse advice line because, with 2 kids and a 7-year-old little boy, I'm probably going to find an urgent care somewhere along the way for something that Mason gets himself into. So thank you for letting us know about the nurse advice line so I know which urgent care to go to.
What's interesting is that a lot of the military, TRICARE, the system that we work in, really has all of the resources that you possibly could need. It's just about who do I call to, or who do I get engaged with so that I can know those answers. So we'll make sure, if you missed the phone number already, we'll make sure we post it on our Facebook page. Shameless plug for you to follow our Facebook page, but certainly a lot of opportunities there. So that's wonderful. There's a lot of interesting aspects in terms of transition that I want to dig into, but Major Bailey, what else? Did you have something else that you want to mention?
Well, actually, I did want to ask one more question about the TRICARE. So easier for the kids, but is it the same for me as an active duty if I'm in South Dakota for a little while? I'll be good if I call the nurse advice line if I need to go. I mean, I blame my son Mason all the time, but let me tell you, I'm pretty haphazard as well. So I can call the nurse advice line, get that referral, and I'll be fine going to wherever they tell me as well without any concern for referral issues.
Yeah, absolutely. So the nurse advice line, you actually need to call if you're active duty military. So family members, they don't need a referral to go to urgent care, but you need to also make sure you're going to an approved urgent care center. Which is really why you should call even if you are authorized to go, because they can make sure you're directed to one that you're going to. For active duty military, you can't go to urgent care unless you have a referral. So that nurse advice line can actually give you that referral that you need to go to the urgent care you need to go to.
Awesome. Thank you.
Yeah, that's great. Wow. Well, you know what? I'm going to actually pass it over to Major Bailey for any topics or ideas that people may need to consider as they're moving.
Well, I think one of the biggest ones, especially in some of the departments that I oversee, is pharmacy. And kind of going along with the constant theme with PCSing, which is pre-planning out, making sure that you're projecting out. It's about getting your medication. So depending on how long you're going for your PCS leave, make sure that you have enough medication to cover. And if you don't, then you have a couple of options. You can either go to an MTF that's close by you. When you get to that MTF, they are able to call back to Lyster's pharmacy, and they're able to transfer the prescription over to that MTF that you're at, and you'll be able to get a refill there. You can also go to a network pharmacy and do the same thing. You'll just provide them with our Lyster phone number so that they can pull your prescription there. The prescription will still be valid until all the refills are complete. Another option that you have is to make sure that you're getting your refills before you leave. So for a 90-day prescription, you can call it in 30 days early. For a 30-day prescription, you can call it in 7 days early. Or you can always go to your PCM and see them before you leave and get a new prescription entered.
Oh, that's great. No, that's fantastic. I know we've seen some comments on Facebook about some interest in, what does it all mean? Particularly as we're looking at MHS Genesis transition, and by and large, all of the continental U.S. now and some of OCONUS locations are all in MHS Genesis, which I think folks will start to really get the benefits of that in their electronic health record. But I know we've seen a lot of comments about the pharmacy and what is, our continued medications and refills look like. So thanks for that. Awesome. Well, I'm going to pass it over to Lieutenant Colonel Murray. What tips do you have for our listeners on their moves?
Well, I also don't want the listeners to forget that, you have your family members, but don't forget about your fur babies too. Make sure that you visit your veterinarian, get their medications squared away as part of your checklist. But speaking of checklists, you have your binders and your checklists for your checklists, et cetera, and you're running around. One of the things that we do forget about taking care of and making sure we got on the checklist is yourself and your family. And stress could be super, super high. I know from personal experience, all the moves, OCONUS to OCONUS, OCONUS to the States, reuniting with family members, et cetera, that you really, on your long drives, you forget to drink, forget to hydrate. So it's very important that you take a moment out of your day, several times a day, to remember, am I taking care of myself? Am I taking care of my family? Am I hydrating? Am I eating? Am I getting my proper hydration in? Am I sleeping? All of these things that you often forget because you're trying to focus on things like the nitty-gritties of making sure that you get papers in, et cetera. So my big advice for just the listeners is to make sure that you are including yourself on that checklist.
I hear comments like that when I've gone through my career, and not just for moves, but any stressful situation. And I'm like, yeah, I got it. I'm going to take care of myself. But I don't ever plan and schedule that time, right? And even when you're moving, what does that look like? When you're at the hotel in North Dakota or something like that, are you going to go take a run or whatever it is that kind of resets you? So I think that's really powerful. And I tell you what, as we're kind of closing on our time, maybe if we can, I'll go back around the room and listen to what aspects and tips you might have of maybe how the guests here have helped manage stress in their own way, either with their family and maybe how they frame it with their family, but how they manage stress when they're moving. And so I'll head over here to Major Kuhlman first.
Yeah, thanks. So first off, I should say have a plan, and not just have a plan, but communicate that plan to your entire family. So not just your spouse, but also your kids, so that they know what's going on throughout the move as well. Yeah,
that's good. It's sometimes cheesy to think, but it's like you want to have a board meeting, right? Or a battle update brief, for the family as you're moving along, because it can be stressful, but less stressful if you know what's happening the next day, right? Be it you're going to get ice cream or not ice cream, whatever the topic might be. Major Bailey, how about you?
I do something similar. I involve the kids. So we look from the location that we're at to the location we're going, and we try to find either tourist events or features in which we're going, so then they can help pick out what they'd like to see as we go across the country. I remember one specific PCS, we were going from Georgia up to Washington the first time we were in Washington. And Bella was about 2 years old. We were going through California. It was a little bit of a harder state to get through. So what we did was we looked for caverns. And at the time, she was very much into the Smurfs. So we said we were going Smurf hunting. And we would go find all the caverns along the way. And those would be our pit stops so she could look for Papa Smurf.
That's fantastic. Did you find Papa Smurf?
We found his colony in her eyes.
Well said. Well said. We should mark that as a quote. That's wonderful. And Lieutenant Colonel Murray, how about you? What ways have you structured moves for your family?
For upcoming moves, because now my children are getting ahead and getting ideas from the deputies here, what I'm going to include in my armamentarium is to have my children put together their own checklists of important things. So, hey, what stuffed animals are important to you? What books are important to you? And kind of get their own little PCS checklist together, and that make them a part of the actual planning piece, kind of like what Major Bailey was talking about. I think that's important, involving the kids, because then they feel like their voice is being heard and that they're important as well.
Oh, wow. That's really great. And I would argue, even though that you're just kind of proverbially moving down the hall, quote unquote, there's even stressors that come with that, for the parents. So, a lot of these tips that we've provided here today, maybe not traveling through North Dakota to find Papa Smurf or what have you, but in all honesty, there's some application there. So thank you for that. I really appreciate it. The thing that I would mention and follow up with as we're kind of closing our time is, hiccups are going to happen, but planning helps you get across those hiccups as best as possible. I know from my last PCS, and I'll save you the details, but each one of our family members had something fairly traumatic, be it medical or administrative or otherwise, and they all happened. But you know what? It happens and you move through it. And tomorrow is going to be just as great. You just got to keep rolling with it and keep positive attitude. You'll get to your next duty station. You'll be like, whew, that was rough, but here we are and meeting new friends. Well, again, I want to thank our guests, Major Kuhlman, Lieutenant Colonel Murray, and Major Promotable Bailey for joining us today. Again, they're all moving, so this is bittersweet for me, but I am so happy to have shared the past year with you. Why I joined the Army and why I stayed in are two different aspects, to a little bit to Major Kuhlman's point, but I can tell you that the leading reason that I stay in is because of the people and the culture. And while we're all disparately separated across the globe, it is a very small community inside of the United States Army. And so I want to also thank you for your service to our nation, to Fort Novacell, and Army Aviation, Lyster, and for your camaraderie. And I wish you Godspeed on your travels. To our guests, thanks for listening to this month's episode. Tune in again next month for another topic that's relevant and relatable. Make sure to follow our Facebook and encourage others to listen to the Lyster Health Talks from Facebook, Spotify, or Apple. Again, thanks for listening. Lieutenant Colonel Holt reminding you that your healthiest chapter is ahead and that the only way is forward.
The Lyster Health Talks podcast is produced by the Lyster Army Health Clinic Public Affairs Office at Fort Novacell. Join us in July as the team talks about summer safety. Stay healthy, Fort Novacell.